So we know that a network of family, friends, supporters can really provide a foundation of resilience. And in those of us who are in healthcare, I think it's important to have a network of physicians or co-residents or co-students that can help in supporting you in whatever phase of your medical education or training or practice that you may be in, to really help build this foundation of resilience. So it's really important to find not only just other family and friends and other supporters, but find people who can relate to your situation. So if you're a medical student, find other students to help provide that support because they can relate to what you're going through. If you're a resident, find other residents that can help you go through difficult and stressful times during your training. And if you're a practicing physician, find other practicing physicians that can be part of your support network. Because they can really help you more because they can relate to your situation, and many times they've gone through it or they can understand your perspective, and that can really help provide a good foundation for resilience. So in times of stress and trauma, few things are more painful or more destructive to a person's mental and physical well-being than isolation. So don't ever go through a stressful situation alone. You should not isolate yourself when something bad happens or when there's a bad outcome on an exam or a patient or whatever it might be. Don't isolate yourself and try to deal with it on your own. But that's like the worst thing you can do. So when there's times of stress, excuse me, and difficult situations, you need to find some other support mechanism and don't go through it alone. So it's very important to find positive social support because we know that's associated with resilience to stress. And positive support, social support has the power to protect us and to strengthen us. So we really need to be able to find this positive social support. Why is that important? Because we know that we are strongly influenced by other people. Studies have shown that each happy friend a person has increases that person's probability of being happy themselves by 9%. And the opposite is true as well. For each unhappy friend that you have, that decreases that person's probability of happiness by 7%. So these are very important numbers. So the friends you have, the people around you, the network, the social network you have has a huge impact on whether you're going to be happy or whether you're going to be unhappy. So we have to keep this in mind as we are building our relationships and our social support networks. We know from emotional intelligence that emotions are contagious, right? So when somebody is happy and upbeat and positive and optimistic, that gets contagious to the other person. But if somebody is angry and negative and critical and judgmental, that can have a negative effect on the other person. So how you feel can really depend on the feelings of those around you. So again, it's so important to recognize that as you're building relationships and your support network. So emotions are contagious. And not only that, we have to recognize that energy is contagious, right? So when someone has positive energy, they're able to really positively affect the other person. But when someone has negative energy, that can have a negative effect on the other person as well. So this is an important concept that we have to recognize as well, that energy is contagious as well. And that is so important in maintaining resilience. So keep that in mind as you're building relationships and social support networks, that energy and emotions are very contagious, and that can have a really profound effect on you. So keep that in mind then. So when you go through these difficulties, you have to find support to help you get through that. And many times you have to be the one that takes the initiative to seek that assistance. So it doesn't mean that you kind of passively wait and hope that someone's going to come rescue you. You have to actively find assistance and reach out to your relationships and your network and your social support, and help you through that situation. So don't just sit there and wait for someone to come rescue you. You have to go out and find your support network and use it effectively. So seek assistance when you're struggling or when you know that you're going through a stressful and difficult situation. So that's so important. There's no shame in admitting that you're having trouble and that you're stressed and you need help, right? Going to someone for help. There's no shame in that, no guilt in that. You need to be able to just go out and talk to friends and peers and coworkers and other social support networks that you might have, because that is very important in maintaining resilience. And that social support network can really be variable for every person. A lot of times it has to do with your own family and immediate family and extended family. It could be your friends, it could be your peers, It could be your colleagues and your coworkers. So there's a lot of different aspects of social support and relationships that can be important in maintaining resilience. And it's important to really use all of these aspects of your social support network to help you through a difficult situation. So keep that in mind. I'll just share a difficult and stressful situation that I went through many years ago, actually, when I was in my residency training. It was one of the few times that I interacted with a patient, a family, and the patient ended up dying. And that is a very stressful situation, and it can have a really detrimental effect on you when you're working with a patient and your patient ends up dying. So I remember, I vividly remember the patient and the day. I know it was in 1998. It was the month of May. It was a Saturday morning. I vividly remember I was a second year pediatric resident, finishing my second year of residency. And I remember coming in on that Saturday morning, being the resident on call in the pediatric intensive care unit. And I remember, coming in the morning and starting to collect information on my patients when the intern from the pediatric floor called down to the ICU and said that there's a patient they admitted last night that was having some trouble, and they wanted me from the ICU as part of the ICU team to come up and evaluate the patient. It was an 18-month-old child that was admitted for stridor and respiratory distress, and he was having these episodes where he was desaturating from the stridor and respiratory distress, and then when he desaturated, he would become apneic and desat, and then his heart rate would drop a little bit, and then they would stimulate him, and he would come back up then. So I assessed him and said, yeah, we need to bring him down to the intensive care unit to watch more closely and to intervene if we need to. I remember bringing him down to the intensive care unit. And then he had more stridor and respiratory distress, and he had apneic episodes. He started to desaturate, and then would have bradycardia and drop his heart rate. And we decided that we needed to intubate him and support his respiratory status at this point. So me and the attending were, intubating him, going through the process of doing that. And as we were intubating him and doing all that, he actually had cardiac arrest, and we weren't able to resuscitate him, and he ended up passing away. And I remember having to talk to the family and telling them about what happened. That happened that Saturday morning on that day in May in 1998. And I remember thinking to myself, "Oh my gosh, what could I have done differently?" Feeling guilty about it. And it's a very stressful situation when your patient dies and a child dies, and you're thinking about what happened, and you're second guessing yourself, and you're questioning yourself. You're feeling guilty about it. And I remember thinking about all that. And I remember again, it was a Saturday. I was on call. It was a 24-hour shift. At that point, then we just had to take care of other patients, and there's other things going on. And I remember just working through that, through the rest of the day on Saturday, through Saturday night. And I remember going, Sunday morning, finishing my work, and then leaving the hospital after 24 hours. When this patient had died. And I remember just going out to my car and just sitting in my car, and for like 20 minutes just crying in my car. Because I had not had a moment to kind of decompress and to kind of absorb what had just happened with that 18-month-old patient that passed away. I remember just sitting in my car for like 20 minutes, finally being able to breathe, finally being able to just decompress, and finally being able to think about what was happening and trying to absorb all that. And I remember it was so stressful. There's so many emotions going through my mind and the different feelings I was having at that time. And I remember coming back the next day on Monday. And the residents that I was with, the attending that I was with, they were really helping me and supporting me, and talking to me about what happened, and just again supporting me through that stressful situation. And I remember that. And then I also remember the residency program director, calling me into his office that Monday morning, letting me know that he had heard about what happened, and again just kind of talking about it and encouraging me, and supporting me through what I was going through with that patient, and the patient dying and things. Then I remember the residency program director, he said one thing to me that really provided me a lot of support and encouragement. I remember he said to me, as you know, I have a 5-year-old daughter. And I'm like, yeah, I know you have a 5-year-old daughter. And he said, you know what, if my 5-year-old daughter ever needed to be hospitalized, you are one of the few residents that I would want to take care of my daughter. And when he said that, that really made a big difference in me, right? To know that he trusted me to take care of his daughter, despite the fact that the patient that I just took care of over the weekend had passed away, and and everything. And that was just really reassuring. That was really encouraging. That was a really supportive thing to say to me at that point. I mean, it really made a big difference in me being able to kind of move on from that scenario and learn from the scenario, and I needed that support. So again, I think there was a lot of people that supported me at that point. My coworkers, my colleagues, my co-residents, the attending, the program director, my own family. There's a lot of support that helped me get through that stressful situation. So again, use the support networks that you have and the relationships that you have to talk about it and to learn from it and to be able to grow from the experience. So that's very important. And I remember that patient very vividly, and the emotion that go through with your patient dying. So again, use your support network to help you get through those stressful situations then.